Welcome to the CareerSmart course on breastfeeding versus formula feeding for infants. This course was designed to help healthcare professionals and consultants develop an understanding of the overall risks, benefits, techniques, and helpful educational information of breast and formula feeding of infants. By the end of this course, you will be able to 1. Identify the nutritional contents in breast milk and formula-based milk. 2. Define the recommended guidelines for the duration of breastfeeding and formula feeding. 3. Describe the recommended technique or procedure for breastfeeding and formula feeding. And 4. Describe the advantages and disadvantages of breastfeeding and formula feeding. The ongoing debate between breastfeeding and formula feeding is not a new issue amongst the media, professional organizations, and new parents. These debates and controversies have focused on trying to determine which method of feeding is superior compared to the other. Several respected health organizations, such as the American Association of Pediatrics, promote strict breastfeeding for at least the first 6 months of life. However, there are medical conditions and lifestyle considerations that can make exclusive breastfeeding difficult. We will also review some of the issues that make breastfeeding a problematic or impossible option later in this course. Research studies have shown that women report difficulties and mixed feelings as they debate the need or wish to formula feed their infants. Often, breastfeeding is portrayed as the maternal and moral choice. However, factors such as the inability to breastfeed, medical contraindications to breastfeeding, and the right to choose must be factored into a parent's decision on which method of feeding is preferred. In other words, breastfeeding may not always be best, and each parent's unique situation must be addressed to determine the most appropriate feeding method.